Hello, my name is Heidi Park and I'm a master's degree student in animal welfare, ethics and law at the University of Winchester. I would like to welcome you to this presentation where we will examine what factors affect therapy dog welfare and animal-assisted interventions, also known as AAI. We will start with some definitions of terms commonly seen in discussions of animal-assisted interventions, a brief history of animals used for therapy, and the risks and benefits to humans of using animals in therapy. Then we will look at the factors that may affect welfare of therapy dogs, a couple of case studies of relevant research, and recommendations to help improve or safeguard the welfare of dogs in AAI. So what are AAIs? Animal-assisted interventions can be defined as the use of animals as adjuncts to therapy in order to positively affect human health and well-being. It is an umbrella term that encompasses animal-assisted therapy, or AAT, and animal-assisted activity, AAA. AAT tends to involve patients with physical, social, emotional, or cognitive needs. It is usually conducted by health or social care professionals and is an integrated part of a treatment plan with clearly defined goals and objectives. An example of this would be a patient who had had a stroke being encouraged to stand up to stroke a dog on a table. On the other hand, AAA tends to be less formal, less structured, does not have a fixed goal, and may be carried out by either professionals or volunteers. An example of this would be a dog visiting a care home and interacting with or being stroked by the residents. Animals involved in AAI differ from service or assistance animals in that they are not trained to assist a designated individual in everyday tasks or to monitor their health status. In this presentation, we will look at the role dogs play in AAI. Participation in any form of AAI has the potential to be stressful for dogs. We will examine what factors affect welfare and whether the so-called therapy dog's welfare is adversely affected by exposure to them. The use of animals in therapy benefiting humans may be traced back as far as the ancient Greeks, who encouraged horseback riding to lift the spirits of the terminally ill. Dogs were associated with Asclepius, the Greek god of medicine, and sometimes considered sacred, so were allowed to roam within healing temples and lick the wounds of the sick. In 9th century Belgium, animals were incorporated in treatment plans for the handicapped, aptly named Thérapie Naturelle. Quaker William Tuke founded his own mental institution in York, England in the 1790s after he witnessed the poor conditions that patients were subjected to, including seeing a mentally ill woman chained naked against a wall. Tuke used rabbits and chickens to help the patients in his retreat. Even Florence Nightingale, mother of modern nursing, advocated the use of small animals to help the chronically sick. It is since the 1960s that interest in animals for use in therapy has garnered scientific interest in modern medicine. Dr. Boris Levinson, a New York psychologist, noticed during treatment sessions that the patient would open up and speak more to his dog Jingles than to himself. These observations led him to publish his book, The Dog as the Co-Therapist, in 1962, which led to greater interest in therapies involving animals. In the modern day, dogs are the most frequently used non-human animal in AAI. This is due to their availability, trainability, and predictability, according to L.M. Glank, but is probably also due to the universal popularity of and familiarity with dogs as companion animal species. They are often referred to as therapy dogs in these settings. There is copious literature in the public sphere depicting the positive effects that dogs have on human health and well-being in studies on AAI. Some specific examples include decreased loneliness in care homes, reduction in post-surgical pain scores in pediatric patients, increased social interactions in dementia patients, and reduction of anxiety in patients prior to blood sampling and dental procedures. This is by no means an exhaustive list, and many other positive effects have been documented. The main risks of AAI to humans are transmission of zoonotic disease, including parasites and bacterial infections, physical injury due to inappropriate contact with dogs, and allergies. But it's generally thought that the benefits far outweigh the risks. It's only in the last couple of decades that more research has focused on how the welfare of animals is impacted during AAI. Demands are placed on therapy dogs to behave in a predictable and desirable manner for the vulnerable people whom they help, and with this comes potential stressors and risks to welfare. Dogs are expected to be gentle, friendly, and sociable, and should be able to follow basic commands for their own safety, as well as the patients they treat and other staff who may be involved. They need to be able to quickly and calmly habituate to their surroundings, which will often be busy places like schools or hospitals where there is lots of noise and activity. They should be willing to interact with different people and may sometimes be in the same room as other therapy dogs or animals of other species. They will be required to tolerate being stroked in sensitive areas of their body, like the feet, tail, or face, sometimes by humans who are not entirely sound in body or mind. Dogs involved in therapy will usually have planned regular visits to sessions at predetermined intervals and will be expected to be in good working condition for these sessions. Assessing the presence and levels of stress is a key part of assessing the welfare of animals, and this is what most of the studies currently focus on that are evaluating welfare of dogs in AAI. Physiological measurements such as heart rate, blood pressure, body temperature, and cortisol levels may be assessed. Cortisol is the most widely measured stress hormone and can be detected in the saliva or urine as well as in the blood, allowing for non-invasive methods of sample collection. Dogs also exhibit many behavioral indications of stress and distress, such as those seen in the photo to the left. This dog has wide, staring eyes with the ears held back and a crouched body posture. Other signs of stress include yawning, lip licking, panting, vocalization, lifting of the front paw, and avoidance of the stressor. Another way to get an indication of canine stress is by examining the perceptions of the dog's handler. Although results obtained could be more subjective, as it will depend on the handler's knowledge and understanding of canine behavior and familiarity with the individual dog, studies have shown that results are generally reliable and correlate well with physiological indicators of stress. Now we will look at some factors that affect therapy dog welfare. The first is the stress of travel. The majority of dogs who take part in therapy will travel to their sessions, although a small number of institutions have resident therapy dogs who live on site. Transport could be a major stressor for dogs, as will be demonstrated in a case study we will look at in a few minutes. There is some evidence to show that traveling more than 50 minutes significantly increases signs of physiological stress in therapy dogs. Therapy dogs are expected to behave impeccably and will go through at least some basic training to achieve this, meaning that dogs could be subjected to coercive training methods. 3/4 of organizations who provide therapy dogs had formal policies on training methods, which is encouraging. However, 25 to 40% did not explicitly ban the use of positive punishment methods or the use of training aids such as choke collars. Positive punishment methods risk causing fear and anxiety in dogs, as well as breaking down of the bond between dog and handler. There are many environmental factors that could also be stressful for dogs. Panting is commonly seen in therapy dogs during sessions and could be a sign of stress, but also could be an indication that the dog is overheating and in thermal discomfort. Venues such as hospitals and care homes are often very warm environments and can simply be too hot for dogs to be comfortable in. In some settings, dogs may have to adapt quickly to situations which could include, for example, riding on an elevator or escalator, walking on floors made from different substrates, and also maneuver around equipment like wheelchairs or crutches, which they may not have encountered previously. Some venues, by their very nature, are very noisy or crowded, such as schools or university campuses. Dogs may be subjected to loud, unexpected noises which may be stressful for them. Some dogs are required to be in situations such as dental surgeries where they must be near tools that produce high-frequency noises, involve motorized parts, or be near hazardous chemicals that could increase risk of injury or harm. A factor that could impact the welfare of therapy dogs significantly is whether they are overworked without sufficient time to recover between sessions. It is generally thought that the more frequent and longer the sessions, the more stressful they are to dogs. But a study by Clark et al. Showed that the dogs who participated in therapy twice a week had lower levels of salivary cortisol compared to dogs that participated once a week, once a fortnight, or once a month. It is unclear whether this indicates that dogs also enjoy or benefit from therapy sessions, or if it is an effect of habituation, with dogs becoming accustomed to the environment and therapy recipients with more regular visits. Further research is required to ascertain what the optimum frequency and length of sessions is likely to be in order not to compromise canine welfare. Therapy dogs will be frequently meeting individuals, whether patients, their family and friends, or staff, that are unfamiliar to them. This can be a discomforting experience for dogs, especially if they are being touched and physically restrained by strangers. The tail, muzzle, and paws are areas of their body that seem to be particularly sensitive to dogs. Dogs show reduced stress levels when they were petted on the chest, shoulder, and tail base. A factor that could significantly alter the impact of stress on therapy dog welfare is the knowledge and experience of the handler. Handlers are sometimes the owner of the dog, but sometimes, especially in the case of AAT, could be a medical or social care professional. Most organizations provide training on dog behavior, as it is important for the welfare of the animal that handlers are able to recognize signs of distress. Handlers' ability to recognize stress and act accordingly will vary greatly depending on the knowledge and experience of the individual handler, but encouragingly, studies indicate that handlers are generally good at detecting stress behavior in dogs. Another important factor to consider is what happens to therapy dogs after they retire. Although it is assumed that most therapy dogs, especially those participating in AAA, are otherwise pet animals and will continue to live with their owners or guardians, there are no studies to indicate the fate of these and other dogs involved in AAT or as resident therapy dogs. This is an important question relevant to welfare assessment, and further research is required to evaluate how and to what degree it affects overall therapy dog welfare. We will now examine two studies that have attempted to assess stress in therapy dogs using different methodologies. Silas et al. Studied 40 therapy dogs involved in AAA to reduce stress levels on campus in university students in Canada. Handlers were asked to complete visual analog scales based on how stressed they perceived their dogs to be, based on behavioral cues, such as lip licking, yawning, lifting of the paw, and looking away. These scales were completed 4 times for each session: at home, 10 minutes after arrival, halfway through a session, and at the end of a session. The researchers found a definite increase in canine stress post-session compared to when the dog was at home, but no significant difference between pre- and post-session stress. This raises the question as to whether travel to or initial exposure to a new environment is possibly more stressful for dogs than participation in the therapy session itself. In another paper, McCullough et al. Studied 26 dogs who visited pediatric oncology inpatients in the US over a period of 4 months. They measured salivary cortisol as well as behavioral indicators of stress or arousal to assess therapy dog welfare, and found that high cortisol correlated well with high incidences of stress-related behavior. They also found no significant difference in post-session salivary cortisol compared to baseline values, indicating that dogs are unlikely to be physiologically stressed during therapy sessions. Many studies are now available in the public sphere assessing the welfare of dogs in AAI, but unfortunately there are limitations to the evidence collated. Firstly, most studies involve only a small number of dogs, which affects variability and therefore creates a higher chance of bias in the results. Studies with large sample sizes may be logistically more difficult to organize, but would achieve better result validity. Another is that most of the published studies have attempted to assess therapy dog welfare by measuring variables such as cortisol levels, heart rate, and behavioral manifestations of stress. However, transient elevations in these variables do not necessarily equate to poor welfare overall, especially as therapy sessions are usually no more than 1 to 2 hours in length and typically are much shorter than this. Additionally, as we have briefly mentioned in a previous slide, some behaviors that may be counted as an indication of anxiety, such as panting, are not specific for stress. Dogs can also pant when they are in a positive emotional state, such as during play, so it is important that behaviors like this are interpreted in the correct context. On an individual level, many factors can affect the level of stress the dog experiences. For example, the exact type of AAI, the nature of the therapy recipient, and the amount of training and habituation time allowed are likely to affect the dog's emotional state during sessions. Many studies also do not differentiate between dogs that have longer or shorter travel times to the venue, which is likely to be stressful to dogs. On a practical point, when organizations are formulating guidelines to safeguard therapy dog welfare, it would be useful to have evidence as specific to each situation as possible. Here are some suggestions for improving therapy dog welfare going forwards. Only individuals with the appropriate temperament and training should be selected to take part in AAI. Training should always be reward-based, also called positive reinforcement training. Punishment-based training is known to increase fear and anxiety in dogs. Transport has been identified as potentially a major stressor for dogs and should be limited to as short a time as possible, ideally under 50 minutes. Handlers and staff who work with therapy dogs should be able to identify signs of distress in dogs and act promptly and appropriately when they recognize these. If possible, therapy recipients should also be given information prior to sessions on what sort of interaction with the dogs is acceptable and what should be avoided. Dogs should have the opportunity to explore the room that the session is held in for a few minutes before commencing to allow them to habituate to their new surroundings. Appropriate protective gear should be available for dogs if it is likely that they may come across hazardous materials or equipment that could cause injury. A suitable room temperature should be maintained in order to avoid heat stress, and fresh water provided for dogs at all times. Sessions should be limited in terms of length and frequency to optimize welfare. However, more research is needed in this area. In conclusion, dogs and other non-human animals have a long history of positively affecting human health, possibly going back to the time of the ancient Greeks. There is copious evidence that indicates therapy dogs can greatly benefit the health of humans in AAA and AAT. We have a responsibility to not only dogs but all sentient animals that are involved in AAI to ensure that they are not subject to undue harm or distress in their roles as therapy animals. Further research is needed to further enhance the knowledge we currently have on the welfare of therapy dogs. Thank you very much for joining me in this presentation. I hope it was informative and interesting.